Thank you, Jess. This report makes an important contribution to a new approach in tobacco control if we were to allow tobacco harm reduction methods and products, along with an early diagnosis of lung cancer and improved smoking cessation, to help those adult smokers who are seeking a fire escape. Many smokers just cannot or will not quit. And in Czechia, if these individuals were provided with accessible, affordable, and acceptable smoke-free alternatives, it might save their lives. And that's indeed what the report shows. That if tobacco harm reduction were implemented, along with an early diagnosis of cancer and improved smoking cessation, up to 280,000 lives can be saved in Czechia. Now compare that to the years in COVID, an epidemic that brought the world to a virtual standstill. WHO and governments tried their very best to reduce harm and reduce the serious infections that led to premature death. And despite all of those efforts, there were still 2 million deaths at least. In tobacco, there are 1.4 billion smokers in the year today, of which 8 million die every year. Just compare that, 8 million per year versus the 2 million that died during COVID. And in fact, there's a solution waiting in plain sight. And that's exactly what we were trying to do with this report on Czechia, which has a population of 10.6 million people. 2.4 million of those are smokers, and 18,000 of them die prematurely every year. And just by the way, 26% of the smokers are female, which is actually highly unusual and a high total of smokers in any population. So we feel that this report will make an important contribution to the conversation about tobacco control and how it can be augmented by tobacco harm reduction. What do we mean by tobacco harm reduction? Simply that adult smokers would be given access to smoke-free nicotine alternatives. It's the smoke that kills, not the nicotine. And we would like to urge governments, WHO, and all stakeholders to carefully consider the contribution that tobacco harm reduction can make. Often the mistake is made that the question is, well, what if these various smoke-free alternatives are dangerous? Are we talking about e-cigarettes or vapes, oral nicotine pouches, and heated tobacco products? The question is always, what if they were dangerous? But shouldn't the question really be, well, what would the contribution be if these products were made available to those smokers who couldn't just simply quit? And that's exactly what we've tried to do in this Czechia report. We hope that you will read this report with interest, that you will critique the methodology, and that you would also do your own research to see how many lives can be saved in Czechia. We would also like to invite you to look at some of the other countries that we've done simulation studies on, and I'm showing you the slide. And you can see that literally millions of people can be saved if tobacco harm reduction were allowed to be implemented. After COVID, several lessons were learned. In the field of tobacco control, 3 lessons stand out. Number 1, respect the science. And the science is clear that nicotine smoke-free alternatives can contribute towards smoking cessation. Number 2, communicate risk accurately and honestly, and eliminate misinformation. And then lastly, there is a role for risk-proportionate regulation in tobacco control. And if tobacco harm reduction products were made accessible, affordable, and acceptable to adult smokers, especially those who just simply cannot quit, we can save lives. And we hope that this report will stimulate the debate into the role of tobacco harm reduction in Czechia and beyond. Tobacco harm reduction works in countries like Sweden, where the government, through risk proportionate regulation, has made it possible for Swedish adult smokers to have access to affordable and acceptable smoke-free nicotine alternatives, such as snus and oral nicotine pouches. And this has driven down their smoking prevalence to 5%, which is the best in the world. It is also fitting for the Czechia report to be launched during the week of the United Nations General Assembly, They will host a conference this week called Summit for the Future. Here, the United Nations is calling for multilateral solutions for a better future. And this ties in well with a significant document adopted by the United Nations in 2011, the UN Political Declaration on the Prevention and Control of Non-Communicable Diseases or Chronic Diseases. They set as goal to reduce death of chronic diseases by 25% in 2025 and 33% in 2030. Unfortunately, these goals will not be met if governments of the world do not embrace the call by the United Nations for a whole of society, whole of government approach and engagement with all stakeholders. Through this report, we urge all stakeholders, and particularly WHO, UN and governments, to consider the best practices such as Sweden, United Kingdom, New Zealand, and then take into consideration countries like Czechia, where we've shown that harm reduction can strengthen tobacco control and save lives. Thank you.